Hi, I'm Tom Fay. I'm one of the directors of Visiting Angels here in Orange County, New York. I want to talk to you today about some of the warning signs that family members, family caregivers should look for as they're caring for their loved one, be that an aging parent or a spouse. Warning signs that indicate some corrective action may need to be taken, usually in consultation with a doctor, resulting in extra care in the home, different medication, different nutrition, so on and so forth. Sometimes these changes can take place over a long period of time, and other times they can take place rather suddenly. But I just want to mention some of the things to look for. Generally, alertness is a factor. If someone has been alert most of their lives, or let's say recently, and all of a sudden they have trouble following conversations or following television, I think that's a sign maybe of confusion, and the confusion is usually associated with a normal amount of dementia that comes to most people as they get older. It would be normal aging dementia. Loss of short-term memory is also a factor of that too. The things to watch out for, though, are if any of these factors become significantly more pronounced. If there's greater memory loss, if there's greater confusion, that may indicate that there's the possibility of an Alzheimer's disease development. We also want to look out for mobility. As someone gets older, their balance may be affected by weakness in the muscles and the bones. It may be affected by arthritis. It may be affected by a balance in the inner ear. All these things need to be watched out for and kind of differentiated because they aren't the same. Arthritis can cause pain, and pain while walking or climbing stairs can certainly affect mobility. Also weakness, because a person has been inactive for a long period of time, over days, weeks, or months. Muscles can weaken, they can atrophy, and weakness can certainly affect mobility in walking, mobility in going up and down stairs. Another factor would be a person's mood. Over the course of, let's say, recent days or weeks, if you've noticed a change in mood from someone who's been generally cheerful to becoming dour and depressed and possibly even angry, that would be one thing to watch out for. Or just as an indication of possible depression. Depression comes to all of us, in particular seniors. Seniors suffer from the notion that the end of their life is nearing. They may not have as many friends as they used to have. They may not have as many siblings around for them. Many of them may have passed away. So all those things contribute to a sense of sadness that can turn into depression. But if we also see mood swings, so that if one time during the course of a day a person is cheerful and then becomes unduly sad and then cheerful again, we might want to look into possible drug interaction that's causing that. Mood swings are not generally a normal thing, especially if they haven't been noticed before. Appearance is another thing. If a person's skin tone looks particularly pale or gray, ashen, if the skin doesn't look resilient, I mean, most seniors experience a loss of resilience in the skin anyway, but if it looks especially not good, we might suspect a couple of things here. Not proper nutrition, maybe not enough of the right foods, maybe not enough hydration. Not enough hydration in the skin will cause it to look saggy and baggy. And lack of proper nutrition will result in a general not good skin color. And also part of appearance would be hygiene. If a person has been noticeably lacking in attention to matters of hygiene, whether that's shaving, keeping your hair combed, or bathing. Sometimes we will notice that some of our seniors don't smell as well as they think they do, or as well as they ought to do. That is certainly something to keep track of. If they tend to wear the same clothes over and over and over again, that's an indication that there may be something else going on. One thing needs to be said though about seniors: they don't need to bathe as much as younger people do. whereas people in their 30s, 40s, and 50s would bathe every day, shower every day. Seniors in their 70s, 80s, and 90s can easily have half that amount and be just fine. A lot of what we've talked about here is part of the normal process of aging, and is not to be in and of itself a cause for alarm. It's just that if the changes have been sudden or pronounced or go back and forth, that would be an indication that something needs to be looked at. And one of the principal causes that we want to check out is medication. Medication interactions are very complicated. If one is taking 2 or 3 different drugs, even just 2 drugs, the amount of medical knowledge about the way these drugs interact is not really very large. Doctors also don't talk to each other, and so one doctor may not know what another doctor has prescribed. Another factor that we have seen very often is that urinary tract infections can be the cause of tremendous concern, and they can cause symptoms to be presented that you never would have guessed in a million years. Symptoms that even look like Alzheimer's or dementia, whereas a person is hallucinating, having never before hallucinated before. Urinary tract infections are a principal culprit and need to be checked out. Anyway, all of these things are the kinds of things that you as a family caregiver can look out for. Visiting Angels caregivers as part of their training, and they know that they're the extension of the family's attention. They're an extra set of eyes and ears, if you will. Visiting Angels caregivers all need to know to look for these things, and by and large, they all know to look for these things. They need to be reported to the family very quickly so that the family can consult with doctors and take any corrective action that needs to be done. Okay, thank you.